Hello, I'm Dr. David Greene, CEO of Preferred Pain Center here in Phoenix and Scottsdale, Arizona. The topic for today is chronic neck pain. How prevalent is it? What to do about it? It's not a small problem. 30% of Americans experience some sort of neck pain on a yearly basis, and about half of those, so 15% of Americans, are dealing with some sort of chronic neck pain issues all the time. So there are multiple structures in the neck that can lead to chronic neck pain. It could be an arthritis issue with the joints in the back of the neck. It could be a muscular issue as a residual from a car accident. There could be a ligament injury that is causing a little bit of instability. It could be post-surgery. You could have had a spine fusion and be having problems at the levels above or levels below. So whatever led you to the chronic neck pain, the question is what to do about it. Well, let's talk about the non-operative options. Going to see a pain doctor, the first thing that will happen is a history and a physical. The pain doctor doesn't want to jump to chapter 8 of a long book. They need to know what led up to chapter 8. How'd you get the neck pain? How often does it come on? Those types of things. Once that's established, a physical examination can help the doctor pinpoint more of where the problem is. Is it just tenderness? Is there range of motion issues? And then the doctor can order some x-rays and potentially an MRI. That can help round out most of the story. If the facet joints, the small little joints on either side of the neck that are about the size of a thumbnail, are deemed to be the source of the problem, and that's called cervical facet syndrome, then what's next can be a medial branch block. A medial branch block is an injection into the areas around those tiny little joints where the little medial branches, they're tiny little nerve endings that supply sensation to those joints. And you know, a joint is just like anything else. It has to get sensation to feel pain. If you can deaden the little nerve endings that bring the pain, you might be able to help patients out a lot. These are not the nerve roots. Nerve roots are what allow you to, use your bicep, make a fist. We're not talking about that. So when a medial branch block is done, diagnostically, a pain doctor injects some numbing medicine around those little medial branches and then asks the patient shortly thereafter, how much pain relief did you get? So like the next day or the next week, they keep a little log, and the answer that you want is 80%. If a patient relieves 80% or more pain relief, even for a few days, it worked, and the facet joints can be deemed the source of the pain. So at that point, you can see how long the pain relief lasts, or it can be repeated if it wears off. The average medial branch block gives pain relief of about 5 months. And then it can be repeated, and the expectation is that the same results will be achieved, for the same duration. That's what the literature shows. Additionally, they've had recent studies looking at just simply doing numbing medicine or adding cortisone to it, and the results so far have been about the same. So a lot of pain docs use some steroid. They feel like it gives some extra benefit, and it may, but it's not always the case. One additional option outside of surgery for chronic neck pain is if the medial branch block works and it wears off, a procedure that can give a more lengthy duration of pain relief is a radiofrequency ablation. Fancy word, not a fancy procedure. Basically, you put a little coil or needle into the back around the joint areas where the needle would go for the medial branch block, and it gets heated up. And it deadens those medial branches for, it could be upwards of 2 years. So instead of 5 months of pain relief, you could be talking about 2 years, which is a great treatment. So radiofrequency is one of the most modern technology procedures that we have today, and it can be very effective for chronic neck pain. Studies show that if you do surgery for simply chronic neck pain from, say, arthritis or some of these other muscular issues, the results are no better than if you just stayed non-operative. Plus, you've added in the risks of surgery. Now, if you have an indication like a pinched nerve with arm pain or some instability, that's a different story. But I'm just talking about chronic neck pain from, let's say, arthritis. Not a good idea for surgery. Great idea for medial branch blocks or radiofrequency ablation. Plenty of information about this on our website at preferredpaincenter.com. We have the blog of pain. Also call us directly at 602 507-6550. We serve patients throughout the valley, throughout Arizona, and also throughout the country with our regenerative medicine, which you can also read about on our website. I'm Dr. David Greene, CEO of Preferred Pain Center. Your pain stops here.